Mark Bishop Show. Truly like a box of chocolates. You never know who you're going to meet. From business, lifestyle, and fun. Here's Mark.
And welcome, everybody, to another Mark Bishop Show. Ali Khan, MD, MPP, FACP. He's a practicing general internist and Chief Medical Officer, Medicare at Aetna, a CVS health company. And you know, he's on the show for a very good reason. Many adults, especially seniors, personal health care often takes a backseat to other concerns. In fact, according to a CDC report, only about 13% of seniors saw a doctor specifically for preventive care in 2023. Now, conversely, nearly 40% did visit a doctor for chronic condition management. So, folks, in this episode, Dr. Ali Khan is going to share his top 3 health to-do items for seniors, from essential preventive care to making sure medical coverage is up to date. And he'll break down his top 3 health must-dos and how to stay on the right track for a higher, healthier year ahead. So take notes, okay? Dr. Ali Khan, it's time to hit the reset button and reprioritize health goals for 26. Will you expand on the big 3, please, for us?
Mark, happy to. You know, when I think about top 3 must-dos for seniors this year, first and foremost is really scheduling your recommended preventive care appointments, right? We are, in this country, we have a lot of reasons for not thinking about prevention, but this is the foundation of staying healthy as we age, right? Which is why, you know, Medicare Advantage plans like Aetna cover these kinds of preventive care services at no additional cost. We want to make sure that people are getting in at the start of the year. We're getting that annual wellness visit done, which is really a great opportunity to work with your doctor or nurse to create a personalized prevention plan for you, kind of a playbook for the whole year of how to stay healthy and how to stay well. And we pair that with your, scheduling your routine physical exam, right? The full physical that you're used to, plus any recommended blood work, lab tests, vaccines, and screenings that give us the opportunity to identify conditions early when they're manageable before they might get out of hand, right? The big piece here is you don't wait till you're sick to see your doctor because these kind of preventive visits are key to staying healthy all year long. And I'll give you one key piece here. One of the most important things we can do after the age of 60 is get your eyes and ears checked every year, right? Annual vision testing and annual hearing testing catches often small differences in hearing that might need a hearing aid, or in vision that might need glasses, or an adjustment to your glasses prescription or contacts, that left untreated can have long-term impacts on our desire to engage socially, our memory, and can even lead to dementia, right?
Wow.
So these are the preventive care pieces that we support at no extra cost because we know how critical it is for you staying happy, healthy, and at home. Mm-hmm. That's number 1. It's a big one, but it's important.
That's an annual wellness visit and the annual physical. This is what you're saying here, right? Get that done.
Yes, sir.
Right, okay. And you went to number 2, eyes and ears checked, because as we age, let's face it, there is an effect there. So what's the big number 3?
The big number 3 is really getting to know your plan and how to engage with it, right? It's not only making sure that you have your ID card, whether that's in your wallet or whether it's on your phone, but that you get to really understand what benefits are available to you, what's covered, what's not covered, and really engaging with, whether it's digitally through the online portals and applications that all of us as plans have, or whether it's just through calling us through any of our member services lines that are on the back of your insurance card, to understand that you've got benefits like 24/7 access to a nurse line when you have questions, no matter day or night, or you may have access to care management programs that are supporting you with extra supports when you're getting discharged from the hospital, or if you're dealing with a chronic disease like diabetes or congestive heart disease. So there's a lot out there that I find, Mark, my patients just aren't aware of. And so getting to know what's available to you and how to set up to be an advocate for yourself and how your plan can advocate for you, that's number 3. It's the big piece of knowing what's due to you and how to take advantage of it.
Well, folks, all you've got to do is, as I say, in your podgies, your pajamas, a cup of joe or tea, health tea, whatever you have, AetnaMedicare.com. Aetna, A-E-T-N-A, all one word, Medicare.com, and that'll tell you a lot. So, Dr. Khan, tell me this. How common is it for seniors to delay or to avoid preventive care appointments with doctors? I mean, do they shy away? Is it a scary thing?
Unfortunately, it's far more common than you think. Today is my mother's 73rd birthday, and she and I were having this exact conversation yesterday. Right?
Ah, wish her happy
She's healthy enough
birthday.
to skip a lot of these visits.
73.
Well, thank you. But, she feels she's healthy enough to skip a bunch of those visits, right? Or sometimes my patients may not understand the importance of how critical these preventive visits can be in setting up yourself for a really healthy year forward. Some people worry about costs, and then some people might not know how they're going to get to that appointment, right? So it's a variety of reasons that cause people to delay those sorts of appointments.
Well, you've mentioned a few things, but in reality, for somebody listening now, and I don't want to scare the living, bejesus out of them, but why is it so important for seniors to be proactive with their health?
Proactive, very simply, means catching those health issues early when they're easiest to manage, right? That's where that combination of the annual wellness visit and the routine physical exam isn't just a checkup, right? It's the kind of holistic care that we can get delivered, especially early in the year, that identifies issues that could become a problem, acknowledges issues that already exist, and builds the plan forward for managing them month by month over the course of the year, right?
Yeah.
That's, I'm a click and clack guy from growing up. That's car maintenance. And that's what, as we mentioned earlier, that's what's really important, to make sure you're doing the small things to keep yourself well and get yourself healthier.
Yeah. That's a good analogy, really. I mean, let's face it, if you leave the car, don't do anything, it's going to break down on you, or no fresh oil changes, or checking the brakes, or whatever you got to do. And the body, I mean, it's a shell, it's a car. At the end of the day, you've got to have things checked. So ideally, put it on the calendar. Every 6 months, would you say, doctor, or even before?
Potentially before. So, annual wellness visit we recommend at the start of the year, every single year. And then those routine physicals, we want them at least once. But oftentimes, your doctors or your nurses will recommend that you're coming in more times than that during the year to make sure, at least every 6 months, but ideally more frequently, that we're catching things in real time and that we're making progress on the things that we've already identified.
Right. And are there stats at all that, you were saying before, we catch things early before they become worse, before they really become, bad and affect you? Are there sort of any stats that say, see, look how many we find early in the game,
Yeah, there's a large amount of research on this that's published academically. There's also good data that we have from internal to us at Aetna and our other, sister health plans. When patients are doing really well at completing those annual wellness visits and getting those annual physicals, seeing the doctor three or more times a year, getting all these screenings right, they are consistently more likely to avoid ER visits or being admitted to the hospital for conditions like diabetes, heart disease, and lung disorders.
Mm-hmm.
They also are folks who are happier in the surveys that we administer, and they tend to stay healthier and be at home longer, right? As opposed to moving into a different care setting. So that holistic approach done up front can do a lot in terms of, honestly, keeping you happy, healthy, and at home for as long as you can be.
Yeah, as you were saying. And you mentioned before, there was no charge for these with Aetna Medicare?
Correct. This is a preventive care that we feel very passionate about. Is something you should be doing early and often.
Well, that's really nice. That's not often you get some of the big boys doing that sort of thing. So I would take advantage of it, folks. I mean, in wrapping up, Dr. Ali Khan, just give us again the 1, 2, 3 you strongly recommend.
Number one, first and foremost, schedule and complete those preventive care appointments that can help set the foundation up for future health. Number two, get those eyes and ears checked, as we talked about every year, as a key part of keeping yourself well and keeping your mind sharp. And number three, get to know your plan and your plan's digital tools so you can be an effective advocate and steward of your own care journey.
Yeah, that one of get to know your plan as a senior. I mean, I'm guilty of this, but is it easy to navigate, and find out and understand where you're all at? I mean, the Aetna side is pretty good, so it's not too hard for them, is it?
No, and that's where I think the digital tools make a world of difference, right? We're all used to calling into phone lines and sort of wondering if we're going to be on hold. That's where these apps and these portals, Mark, just open up a whole world of information right at your fingertips within seconds.
Fabulous.
And that's been a huge game changer for my patients.
Oh, that's good to hear. Thanks, Doc. We got to go. Dr. Ali Khan, ladies and gentlemen, MD, MPP, and FACP, and the Chief Medical Officer, Medicare at Aetna and CVS Health Company. Thank you, Doctor. Have a wonderful week.
You do the same, Mark. Take care.
Join us again for another episode of The Mark Bishop Show. It's a production of Mark Bishop Media.